New cases of the coronavirus are ticking up in some parts of the U.S., with the Omicron subvariant BA2 now the dominant strain. Now, the numbers are still far below the surge we saw earlier this year. That's some good news. But for more on all of it, we're going to bring in Dr. Ashish Jha. He is the Biden administration's new coronavirus response coordinator, and he joins us now, not from Brown University, but from the White House. Good morning, Dr. Jha.
Good morning, Tony. Thanks for having me here.
So let's start, Doctor, with the increase in cases we're seeing in some parts of the country. You've said in the past, very reasonably, that if we see a change in the case count, we might need to go back to masking mandates. Do you see that trending in that direction now?
Yeah, so good news, Tony, is that infection numbers are still very low compared to historical averages, right? And hospitalizations, the metric we care about most, are at their lowest level in the entire pandemic. So I do believe we're going to see cases go up and down. Obviously, if it gets substantially worse, we're going to want to look at issues like masking. But at this moment, these numbers are still quite low. And I think we need to continue focusing on protecting people with vaccines and treatments, I don't think we need to make any other substantial changes at this point.
That's great. That's terrific news. A little trickier news is Congress. Congress has yet to vote on funding for the continued fight against the coronavirus. If that vote is delayed deeper into the spring, how might that affect your efforts and our national efforts to fight the virus?
Yeah, you know, one of the things that we've been able to accomplish in the last year and a half is we have now vaccinated more than 200 million Americans. We have treatments that are much more widely available. How did we get there? Well, that was the effort of the Biden administration, but it was also support of Congress through resources. And when we look into the summer and fall, and we all want to make sure there are plenty of vaccines available for people, that we continue to have treatments available for the American people, none of that is going to be possible without additional funding from Congress. And that's why I remain very confident that Congress is going to step up and do its part, Tony, but it's really pretty essential that they do that.
The current Senate bill has $10 billion in funding to fight the virus. Is that enough?
Yeah, it's a down payment. I think the administration initially asked for 80. They cut it down to 22.5. So the question is, what do we need this money for? We need it for vaccines. We need to make sure that we have plenty of testing available. We need to make sure that we have plenty of treatments available. That's all going to be essential, and we're going to need the resources to make sure that we have that for the American people.
If you had the money, would boosters, which the messaging on boosters has been a little bit confusing, would the recommendation from a medical public health perspective be boosters for everyone?
Now, right now, here's what we know, is we know if you've only had 2 shots and you're an adult, you need to get that 3rd shot. That's all adults should be getting that. That's very clear. The question now has come up in the last couple of weeks, what about that 2nd booster? Very good evidence from Israel that people over 60 should get a booster. I think that part's pretty clear. 50 to 59, if you have risk factors, reasonable. Under 50, we just don't have any data. We always want to be guided by data on these things. And right now, it's under 50, 2nd booster, no evidence yet. 1st booster, every adult needs one.
All right, Dr. Jha, congratulations on the new role. Glad to hear the country is still in a pretty good place, and we'll keep our eyes on Congress for you. Appreciate it.
Thank you so much, Tony.